다음으로는 프리시즌 드리븐 헬스의 대표이신 케빈 로스 박사님이 COVID-19로 인한 바이오 산업에서의 데이터 활용의 가속화에 대해 소개해 주시겠습니다.
Pleasure. It's a pleasure to be part of this event today. Thank you for inviting me. So today I want to tell you two stories of examples of work that's been underway in New Zealand to show some of the interesting work that New Zealand has been doing, especially in the area of health data science. One of the advantages New Zealand has that other countries struggle with is we have excellent digital health records in New Zealand, and we've kept those records for a long time, which means we have the opportunity to explore data and use that data in ways that is difficult in other parts of the world. We also have a real strength, especially at some of our universities, in data science, where we have developed tools that are used around the world to analyse data. So we've brought those two things together with some of our software companies and investors through the government, through the Ministry for Business, Innovation and Employment, to do a lot of work in this space. This became very important in the last few months when COVID-19 hit New Zealand, just like it has hit around the world. And we were asked to help translate academic research and data that was being collected into the government decision-making so that we could decide when to put extra restrictions onto people's movements in New Zealand and what the policies should be. As you can see from the diagram on this page, it's very complicated to model all of health data around COVID-19, and that was the challenge we were set, was how do you very quickly take models and data and make them useful for the decisions that the country needs to make and useful for the decisions that our health providers at hospitals and in general practice clinics need to make. Academics were doing excellent work. Data was being collected in other parts of the world as well as in New Zealand, and we were faced with the challenge of putting that into a useful decision-making framework. What we ended up doing was providing daily updates to the National Crisis Management Centre in New Zealand. So this was the group that advised the New Zealand government on what decisions should be made, what were the latest cases coming through of COVID-19, and what are the implications of different decisions that could be made. This work was published very quickly by New Zealand leading academics, and we provided some of the technology to maintain this information, but also to run scenarios. And this was the most important capability that we had, was no one could forecast and predict what was going to happen with COVID-19, but we could test different scenarios. What would happen if we had an outbreak that we weren't expecting? What would be the implications if you opened the borders and allowed more international visitors to come? What would happen if we managed to contain the virus within the current parameters? So New Zealand, like other countries, has gone through a series of steps, and it's certainly not over in any part of the world. But New Zealand has been one of the successes, as is South Korea, in terms of actually maintaining a really good position relative to COVID-19. And we attribute a lot of this to the fact that New Zealand trusts its scientists and has an excellent science community that have both excellent scientists and excellent science communicators. We combine that with the technology that's being developed, and we've had a real collaborative environment. And our Prime Minister talks about the team of 5 million who have made this collective sacrifice for New Zealand's response to COVID-19, and that's been enabled through the sorts of technologies that have been developed in this space. One of the interesting initiatives that's come out of this is something we've launched called the New Zealand Algorithm Hub. This is where we're making freely available information related to COVID-19 for use across New Zealand. And this is both to understand the spread of COVID-19 under current and different scenarios, but also other algorithms that are relevant, such as what is the risk for one particular person, what is likely to happen for people under different conditions, what is the effect of different sorts of contact tracing when we find a case, and how quickly we can actually control that. One of the challenges that we've been using this hub to solve is that New Zealand has been relatively successful at containing the virus and is now facing a backlog of health needs that haven't been met over the last 3 months. So people have not had their elective surgery that they would have had. People haven't gone in to have that checkup that they would have had, and therefore there are diagnoses that are late, and therefore people are more progressed in their conditions than they would be otherwise. So what we're trying to do through this is make all of the intelligence available, especially to our clinical community, but also to our government policy advisors and to other parts of the sector who are dealing with questions around how should they now respond in the current environment. The Algorithm Hub is really a technology aided by a process. So we have a really careful process around making sure we're using people's data appropriately in New Zealand, and we have governance across that to make sure that we have the trust of society to use these algorithms. Through that process and through this technology, we are opening up the use of these algorithms so that we can make more and more use of this in clinical context as well as in a planning context. Now, all of this is part of a vision that we have around health data, which is recognizing that health data is becoming, health itself is becoming a real data science. Slides are going on their own speed. So what we believe is that the way that medicine is practiced today is primitive compared to what it will be in 5 or 10 years from now. And so we will look back on this time and think this was really not taking advantage of what was possible. And the reason we think that is that health is still using old technology and is still treating everybody as if they're the same. Modern data science and modern data makes it possible to change that. So we have a partnership in New Zealand called Precision Driven Health that is combining a lot of different companies, a lot of different universities, a lot of different health providers to change that and to make better use of data to build tools that can be deployed in New Zealand and around the world and can be commercialized with a lot of opportunities coming out of those. All of the work that we do is summarized by the experience of what a doctor or a nurse has with a patient every day, which is you see someone who has some questions, you take those questions and you match it against what you know about the patient, and then what you know about the health system and what you know about medicine. And you say, for people like you, this is the advice I need to give you. And what we're doing is, rather than having a person do that and have to process all that information, we're developing intelligence to do that. So artificial intelligence and machine learning is enabling us to read lots of medical records and lots of published research, combine that information together and say, for these sorts of people, this is the advice that's the most important to give. One example where we're doing that is predicting readmissions. So if someone's admitted to hospital, when they're discharged, you don't want them to come back unless you're expecting them to come for a checkup. So what we've done is used this technology and this data science to predict who is most likely to be at risk of readmitting when they shouldn't. We apply this data science and these tools to those patients. We flag that these people are at particularly high risk, and we put them on a more targeted program so that people follow them up specifically in a way that can help to reduce the risk of an unnecessary readmission to hospital. We're seeing more and more examples of this across many applications, where the fact that New Zealand has really good combined data and data science capability, bringing those together and putting this into this ecosystem that Diana's shared, means that we can develop high-tech startup companies that are using these ideas, as well as infrastructure that's available at a national level. And so we would love to collaborate further in this, and you're welcome to look up more about the Precision Driven Health Partnership on the website and the Twitter feed that you see there today. Thank you very much.